Roles and Responsibilities of Community and Public Health by Sabrina Williams. The knowledge of the roles and responsibilities of the community and public health should be one of our top priorities as healthcare professionals. It is our duty to make sure all of our citizens are equipped with the knowledge that they need in order to have a great quality of life and as well prevention from chronic and infectious diseases. Throughout this PowerPoint, I will be describing the role of the community in public health and the well-being of populations, describing the public health organizational structure, examine the legal and ethical dimensions of public and community health services, analyze the fundings of public and community health services, and as well discuss the role of communication in the community and public health program. The role of community and public health is to improve the health-related quality of life by preventing disease, illness and injury, and impacting social, economic, and environmental factors fundamental to excellent health. A role in the community and public health would include the tracking and investigation of health problems and hazards in the community. Information will be gathered and analyzed to determine risk and problems. The preparation for a response to the public health emergencies is another role. The response to outbreaks of diseases is critical, and the preparation for any public health event is vital. Another role is to develop, apply, and enforce policies, laws, and regulations that improve health and ensure safety. Policies to meet health needs of emerging issues is very important. Leading efforts to mobilize communities around important health issues is another role. This will help the community tackle disease prevention and personal health care needs. Linking people to health services is one more role of the community and public health. They connect people with personal health services. And one last role will be to achieve excellence in public health practicing through a trained workforce, evaluation, and evidence-based programs. The assurance of knowledgeable and skilled workers is the most successful method in the well-being of the population. Public health and well-being focuses not only on mental and physical health, yet as well disease prevention and health promotion. Well-being of the population is associated with self-perceived health, longevity, health behaviors, mental and physical illness, social connectiveness, productivity, and the factors in the physical and social environment. A public health organizational structure of the state health departments throughout the United States was conducted to compare findings with a previous national assessment. It provided a synthesis of the growing field of the public health systems research related to the structure and organization of state and local governmental public health agencies. The findings captured an overview of research that examined the influence of organizational characteristics on public health performance and health status, and as well as a summary of the strengths and gaps of the literature to date. In 2001, the surveys were sent all throughout 50 states, which inquired about the structures and functions of the state health agency. In the result, it was determined that the organizational performance needed to be further researched to better ensure that public health structures and functions yield maximum health outcomes. It has been stated time after time how our country currently does not devote the resources needed to adequately help prevent disease and protect the health of Americans. Not having the financial resources is putting our families, communities, states, and nation at risk. An increase in funding is necessary for the Centers for Disease Control and Prevention, the Health Resources and Services Administration, and other public health services agencies. These increases need to be acted on immediately and sustained over time. Previous budget cuts new challenges, and responsibilities have caused these critical, important agencies to struggle to provide basic public health services. More investments are critical in our public health agencies and programs in order to provide adequate health protection of the American public. It has been stated time after time how our country currently does not devote the resources needed to adequately help prevent disease and protect the health of Americans. Not having the financial resources is putting our families, communities, states, and nation at risk. An increase in funding is necessary for the Centers for Disease Control and Prevention, the Health Resources and Services Administration, and other public health services agencies. These increases need to be acted on immediately and sustained over time. Previous budget cuts, new challenges, and responsibilities have caused these critical, important agencies to struggle to provide basic public health services. More investments are critical in our public health agencies and problems in order to provide adequate health protection of American public. As a healthcare professional, having great communication skills are very important and is well used daily. Health communication covers all areas of disease prevention and control, health promotion, and medical care. Communication is used frequently by patients, patient family members, and as well their communities and workers. Health communication is a core to people's ability to gain access to the public health and healthcare systems, self-care and chronic disease management, and people's understanding of clinical recommendations and expected outcomes. This concludes my PowerPoint presentation. Thank you.